Hey there, welcome back to my channel. And if you're new here, I'll introduce myself. I am Tiana James. I am a full spectrum menstrual cycle awareness educator and holistic reproductive health coach. So I help women with difficult menstrual cycles restore balance to their reproductive cycles and finally heal from any debilitating symptoms they may be experiencing throughout their menstrual cycle. My goal with this channel is to simply share wellness information and knowledge so that you can use it as preventative care. So I want to be clear with the fact that I am not an expert, nor am I a doctor. I am a student. I am constantly expanding my knowledge in the areas of fertility awareness, menstrual cycle awareness, and natural and holistic approaches to reproductive health. And I am here to share with you what I've learned. So, my favorite saying is to chew up the meat and spit out the bones. Please do your own research before you take my word on anything that you hear here. And with that being said, let's get into this video. All right, so I was reading through the September-October issue of Essence magazine. And, in the first few pages, there are a lot of ads. And usually there is some kind of birth control ad in any kind of magazine, right? So I was getting my hair retied and I had time to actually stop on one of these ads for the Myfembree. I just wanted to read through it and see what they were actually saying. So the first few lines got me because it said that getting my heavy periods from uterine fibroids under control, yes, please. So Myfembree is for women who have heavy periods, usually from uterine fibroids. This is marketed, of course, this is a Black women magazine, full of Black culture. This magazine is for Black women and men, of course, too. So of course they have the ad with a Black woman, and she has seemingly 2 daughters. So this ad is targeting Black women. We know that it's very common for Black women to suffer from heavy periods due to uterine fibroids. And the hashtags that they used on this picture with this Black woman and her 2 daughters is hashtag less bleeding, same life, hashtag my perfectly imperfect life. So keep those 2 hashtags in mind when I go through these pages and these words. I'll say that the less bleeding, same life seems a little deceitful to me. All right. So my hands are pretty full, so I'll let Myfembree take care of heavy bleeding. My hands are pretty full, so I'll let Myfembree take care of heavy bleeding. That statement alone bothers me and concerns me, and I know that it is a common situation for Black women to be in. They're busy. Of course, this woman has 2 kids and she has a home and she has an animal, and I'm sure she has to work, and among all the other things that she is into as a young Black woman, your hands are full. But the fact that if we are having heavy bleeding due to uterine fibroids, why can't we normalize a woman taking the time to take care of herself? Because heavy bleeding, uterine fibroids alone, but heavy bleeding from uterine fibroids is enough of reason to put some things down and let's take care of my health first, and not leave your health up to doctors who prescribe pharmaceuticals for every symptom. So I'll let Myfembree take care of my heavy bleeding. It's the first and only FDA approved once daily pill proven to reduce heavy period bleeding in premenopausal women with uterine fibroids. There is an asterisk to go down to the footnote that says that Myfembree should not be taken for more than 24 months. So let's go back to this is a once daily pill for premenopausal women. Women think of the term premenopausal as you're getting close to menopause, but actually premenopausal refers to women who are between the ages of 18 and 35. After menarche, which is your first period, when you reach menarche, that's your first period, you are in the post-menarche phase for the first 5 to 10 years, I believe. And I think the average age for menarche is 13, I think. I want to say 13. So for the first 5 to 10 years of, reaching your first period, you're considered post-menarche. And then you're premenopausal from, those 5 to 10 years or the age of 18 all the way through to 35 or 40, but I want to say 35. And then you're perimenopausal from 35 to 40 all the way till you reach menopause. You're considered in menopause after 1 year of no periods and no ovulation, of course. So women usually think that premenopausal is when they're close to reaching menopause, but that's not true. Perimenopause, which means around menopause, is when you're considered close to menopause. All right, so premenopausal women is from that 18 to 35 years old. All right, with Myfembree, bleeding went down by an average of 84%. So there's another footnote in 2 clinical studies versus an average of 17% reduction of blood loss in women taking placebo by week 24. So they've only had 2 studies, or I won't say they've only had 2 clinical studies, but in 2 clinical studies, bleeding went down by an average of 84%. And one thing that I learned in my studies for becoming a holistic reproductive health practitioner is how to read clinical studies, how to read statistics. They only stated in 2 clinical studies, the bleeding went down by an average of 84%. Now, they may have had more than 2 clinical studies and the bleeding did not go down by an average of 84% in those other studies. That could be the case. I'm not saying that's the case. I'm just saying that could be the case. So in 2 clinical studies, the bleeding went down by an average of 84%. All right. So less bleeding, same life. I'll take it. Ask your doctor about Myfembree, a non-surgical treatment. Myfembree is a combination of relugolix, which is in 40 milligrams in this pill, estradiol, which is 1 milligram, and norethindrone acetate, which is 0.5 milligrams. And these are tablets. I'll get to what relugolix is. Estradiol is a synthetic version of estrogen, and norethindrone acetate is a synthetic version of progesterone. All right, so whoever reads these little small words, this is the fine print, I never read these, but I just wanted to go through and read this because it's alarming, it's concerning. Me personally, if you know me, I do not deal with pharmaceuticals unless it is an absolute emergency. That's who I am today. I don't deal with pharmaceuticals. I don't take pain medication for anything. I have been off of hormonal contraceptives since I got pregnant with my first child, which he is 10 now. So let's just count, he's like 10 and a half, and then the 10 months that I was pregnant. So I'll just say 11 years it's been since I've had any hormonal contraceptives. So I'm not taking pharmaceuticals for anything. If I'm experiencing something, I'll get down to what the root cause of it is, and then I'll heal that problem to get relief from my symptoms. So I think it's very important that we as women, humans period, but especially we as women, read the fine print on the pharmaceuticals that we take, because the doctors like to make the side effects seem like they're very rare, uncommon, or just never happen, or they're just not that serious. But the side effects are listed because in the clinical studies, some of the women, if not all of the women, experienced those side effects. So they have to list them because this is what came up in the clinical studies. And so I think it's very important that we read the fine print and take the side effects serious, because with that, you are allowing yourself to make a fully informed decision on if you want to use this method for relief, or do you want to explore other treatment options that maybe have different or less or no side effects. All right, so the use. Myfembree is used to control heavy menstrual bleeding due to uterine fibroids in premenopausal women, that is more than 18 years of age. It should not be taken for more than 24 months. So if you choose to use Myfembree for your heavy periods, you should not be taking it more than 2 years. And sometimes I can understand, okay, maybe a woman is in school and she's trying to get her degree, or whatever the case may be. She just started a new job and she wants to really put her head down and work and try to get ahead. She might need 2 years. Like, I just don't have time to deal with these fibroid situation. This heavy bleeding is just making my life I'm not able to function in my daily life around menstrual time. So I just need these 2 years to just let Myfembree take care of the heavy bleeding. I can understand that. I get it. Just know that this is not something that you are supposed to be taking longer than 24 months. Okay? If you decide to. Important safety information. This is the boxed warning. So this is what you'll see on the box. All of this is what you'll see on the box warning. Cardiovascular conditions. Myfembree may increase your chances of heart attack, stroke, or blood clots, especially if you are over 35 years of age and smoke or have uncontrolled high blood pressure. Okay, so there's that over 35 years of age. This is for premenopausal women. When you are 35 years or older, before you reach menopause, you are in the perimenopause phase. Okay, so this is for premenopausal women. That means the ages of 18 through 35. So if you are over 35, your chances of heart attack, stroke, or blood clots will be increased, which is a common risk when taking any kind of hormonal therapy. Because that's really what this is hormone therapy. It's the estradiol, the norethindrone acetate, which is synthetic progesterone. So stop taking Myfembree and call your healthcare provider, or go to the nearest emergency room right away if you have leg pain or swelling that won't go away, sudden shortness of breath, double vision, bulging of the eyes, sudden partial or complete blindness, pain or pressure in your chest, arm, or jaw, sudden severe headache unlike your usual headaches, weakness or numbing in an arm or leg, or trouble speaking. All of these things happen in the clinical studies, and this is why they have to state this. So know that. All right. Do not take Myfembree if you have or had blood clots in your legs, lungs, or eyes, a stroke or heart attack, a problem that makes your blood clot more than normal, blood circulation disorders, certain heart valve or rhythm problems that can cause blood clots to form in the heart, high blood pressure not well controlled by medicine, diabetes with kidney, eye, nerve, or blood vessel damage, certain kinds of severe migraine, headaches with aura, numbness, weakness or changes in vision, or migraine headaches if you are over 35 years old. Some healthcare providers are good enough to say, let me look in your chart. Let me see what you deal with first, what kind of conditions and symptoms you experience before I prescribe this medication to you. A lot of them don't. And they will prescribe this medication to you and tell you that it's fine. Nothing's going to happen. You'll be fine. You can take it. But it is important for you to understand what exactly, these are called, like the do not take if you have, these are called contraindications. If you have these issues, do not take this medication. A lot of healthcare providers will not consider the contraindications. They'll give it to you because most women are fine with it, or most women are not fine on it, and they come back and they talk to their healthcare providers about the symptoms, which are usually side effects from a prescribed medication that they're taking, and the healthcare provider will tell them that's not from your birth control pill. That happens so many times to so many women. I've heard that story over and over again. So that's why it is important for you to understand the side effects that are listed for any pharmaceutical so that you can make an informed decision on if you want to take the risk in taking this medication and letting Myfembree take care of the heavy bleeding. Also, do not take if you have had breast cancer or any cancer that's sensitive to female hormones. I think that's a given. I don't imagine any healthcare provider giving a woman who's had breast cancer or any kind of cancer any like synthetic hormone therapy. Hopefully not. Osteoporosis, undiagnosed vaginal bleeding, and liver problems. All right. Do not take Myfembree if you smoke and are over 35 years of age. Okay. Do not take Myfembree if you have had a serious allergic reaction, meaning like swelling of your face, lips, mouth, or tongue, trouble breathing, skin rashes, redness, or swelling or an allergic reaction to relugolix, estradiol, norethindrone, or any of the ingredients in Myfembree. So if you are allergic to any of these, of course, do not take Myfembree. All right. Also, part of the box warning is bone loss, decreased bone mineral density. While taking Myfembree, your estrogen levels may be low, which can lead to bone mineral density loss. Less bleeding, same life. Is it the same life if you experience bone mineral density loss? A woman between the ages of 18 and 35, I don't think she wants to take any medication that will cause bone mineral density loss at such a young age, when she will have so much life ahead of her. And we already know that as you get older, if you're not well nourished, you're already losing bone mineral density. And so taking a medication that will lead to bone mineral density loss, I think that that's something that should be, you know, very well explained by your healthcare provider. If this happens, okay, if you lose bone mineral density loss, if you have bone mineral density loss, your bone mineral density may improve after you stop Myfembree, but complete recovery may not occur. Less bleeding, same life. My perfectly imperfect life. It is unknown if bone mineral density changes could increase your risk for broken bones as you age. Is it really unknown, or is it just common sense? You be the judge. For this reason, you should not take Myfembree for more than 24 months because it's gonna cause bone mineral density loss. Your healthcare provider may order an X-ray test called a DXA scan to check your bone mineral density when you start Myfembree and periodically after. Suicidal thoughts and behavior and worsening of mood. Okay? That is the subtitle of important safety information. Okay? Suicidal thoughts and behavior and worsening of mood. If you're already having suicidal thoughts and behavior, I hope that your healthcare provider is not prescribing you hormone therapy, I think. Not hormone therapy that causes suicidal thoughts and behavior. And then sometimes your healthcare provider doesn't even know if you have suicidal thoughts or behavior because a lot of women do not reveal that to their healthcare providers when they're just going in for birth control. Some women do. They go on birth control when, you know, they are having mood disorders. Call your healthcare provider or get emergency medical help right away if you have any of these symptoms, especially if they are new, worse, or bother you. And again, this is being listed, stated because this has happened to women in the clinical trials. Thoughts about suicide or dying, attempts to commit suicide, new or worse depression or anxiety, or unusual changes in behavior or mood. Pay attention to any changes, especially sudden changes in your mood, behaviors, thoughts, or feelings. So many women today are experiencing anxiety and just really horrible moods where they are just feeling depressed and they're sad, they're anxious. They just don't have a good outlook on life. I think that if you are already experiencing these symptoms, going on Myfembree, and the reason you would need Myfembree is because of the heavy bleeding, which makes life hard to live. Like, it makes your daily life hard to live when you are having heavy periods. I'm a licensed cosmetologist, so I'm a hairstylist also, and I see women every single day, and I can't tell you how many times a woman comes in and she is just not herself, and she is just quiet, and her face just looks like she's in pain when she is on her cycle. Already that life is hard. And for you to be prescribed something that may cause these kind of thoughts, behaviors, and disorders, that is not in line with less bleeding, same life. That is not in line with my perfectly imperfect life. All right. Abnormal liver test. Call your healthcare provider right away if you have any of these signs and symptoms of liver problems. So jaundice, dark amber color urine, feeling tired, nausea and vomiting, general swelling, right upper stomach area pain, bruising easily. again, Myfembree can cause these things, and that's why they have to state it on their important safety information, the boxed warning, because it is likely that these things will happen. Women have experienced these in the clinical trial, so they have to list it and state it. This is, again, not in line with less bleeding, same life. Maybe less bleeding, but same life? I don't think so. High blood pressure. See your healthcare provider to check your blood pressure regularly. So more than your annual visit to your OBGYN, because usually your OBGYN is who would be prescribing your Myfembree. Maybe your internist may be prescribing it too, but more than likely your OBGYN, who you go see once a year if you are just healthy and normal, you don't have any issues. Some women go in for whatever symptoms that they are experiencing. But yes, you have to go into your healthcare provider to check your blood pressure regularly. You can check your blood pressure at home, I believe you can. But yes, go into your healthcare provider regularly to check your blood pressure. So maybe you are going in more than you normally would go in to see your healthcare provider just to get your high blood pressure checked, because Myfembree can cause high blood pressure, right? Less bleeding, but is it really the same life? Effects on pregnancy. Of course, you don't take Myfembree if you're trying to become pregnant or are pregnant. It may increase the risk of early pregnancy loss. If you think you're pregnant, stop taking the Myfembree right away. Call your healthcare provider. Myfembree can cause decreased or no menstrual bleeding, making it hard to know if you are pregnant. So watch for other signs of pregnancy like breast tenderness, weight gain, and nausea. Myfembree doesn't prevent pregnancy. All right. You will need to use effective non-hormonal methods of birth control, like condoms and spermicide, during and for 1 week after stopping Myfembree. So for the 2 years that you are allowed to use the Myfembree, you cannot use any hormonal methods of birth control. But also, Myfembree does not prevent pregnancy. So now you have to know how to, of course, identify your fertile and infertile days, so that if you are trying to avoid pregnancy, you can do that effectively. Like I said, I am a menstrual cycle awareness educator, and I teach women how to identify their fertile days of their cycle, so they can, if you're trying to avoid pregnancy, either do that by abstaining from intercourse during those fertile times, or choose to use a barrier method during those fertile times to avoid pregnancy, or alternative sex play during those fertile times. And if you are trying to achieve pregnancy, you know when to receive sperm inside of you, semen and sperm inside of you, so that you can conceive. So, but with Myfembree, for the 24 months that you are able to take Myfembree, you have to use a non-hormonal method of birth control, because Myfembree does not prevent pregnancy. All right. So, do not take hormonal birth control, such as birth control pills, because they may increase the side effects, and Myfembree may not work as well. Uterine fibroid prolapse or expulsion may happen. Okay, so fibroids can come out completely or partially through the vagina. So you call your healthcare provider right away if you have increased bleeding from the vagina, which can be serious or cramping. Severe allergic reactions. Myfembree may cause swelling of your face, lips, mouth, or tongue, trouble breathing, skin rashes, and redness. Okay, my perfectly imperfect life, Myfembree claims. Okay, less bleeding, not the same life though. Not if it's causing things like this. All right, and the most common side effects are hot flushes, increased sweating, night sweats, abdominal abnormal vaginal bleeding, less bleeding, same life, but the most common side effects include abnormal vaginal bleeding, hair loss or thinning, and decreased interest in sex. Okay, I'm gonna go through that again. Most common side effects are hot flushes, increased sweating, night sweats, abnormal vaginal bleeding, hair loss or thinning, and decreased interest in sex. Okay, this prescribed medication called Myfembree is claiming that you'll have less bleeding and the same life, but the most common side effects are those which are very parallel to women who have reached menopause. The most common side effects are the same common side effects as women who have reached menopause. These are not all the possible side effects of Myfembree. Call your doctor for medical advice about the side effects. Okay, these that we've listed are not even all of the possible side effects. There are more, but maybe we just ran out of space, or we're just not gonna let you know what the other ones are because you may choose to not take Myfembree. All right, so tell your healthcare provider about all your prescription and over-the-counter medicines, vitamins, herbal supplements. If you take oral PGP inhibitors, I'm a student. I don't know what that is, and I'm not going to go into that. Take Myfembree first and wait at least 6 hours before taking the PGP inhibitor. Ask your healthcare provider if you are not sure if you're taking this type of medicine, of course. All right, so that is the fine print of Myfembree. I also, when I was reading this, I had never heard of relugolix. So I decided to research what relugolix is because it is 40 milligrams of relugolix in the Myfembree. And again, the 1 milligram of estradiol, and then the half milligram of synthetic progesterone. So I'm just going to use simple Google just to look up what relugolix is. I'm just going to go with, okay, Medline Plus, the first one. All right, relugolix is how it's pronounced. All right, it's used to treat advanced prostate cancer. Prostate cancer is male cancer, okay? Cancer that begins in the prostate, a male reproductive gland, in adult men. That's the first statement of why is this medication prescribed. Okay, so relugolix is in 40 milligrams in one tablet of the Myfembree, a medication that is used to treat advanced prostate cancer. Relugolix is in a class of medications called gonadotropin releasing hormone receptor antagonist. So it blocks the gonadotropin releasing hormone receptors. So gonadotropin releasing hormone is the first hormone that is released in the reproductive cycle, which is released by the hypothalamus in the brain. When the hypothalamus releases gonadotropin releasing hormone, it triggers another hormone called follicle stimulating hormone, which tells the ovaries or the testes to start to produce eggs or sperm, right? So relugolix works by decreasing the amount of testosterone, which is the male hormone produced by the body. This may slow or stop the spread of prostate cancer cells that need testosterone to grow. All right, how should this medicine be used? Comes as a tablet taken by mouth. You take it with or without food once daily. Take around the same day every day. It just sounds like a birth control pill, right? Before taking Relugolix, you're going to tell your doctor and pharmacist what other prescriptions and non-prescription medications, vitamins, nutritional supplements, and herbal products you're taking or plan to take, because your doctor may need to change the dose of your medications temporarily or stop your treatment or monitor you carefully for side effects. You should know that Relugolix is intended only for use in men. Relugolix is not intended for use alone in women, okay, but can be used in combination with other medications for other uses, okay? So in the case of Myfembree, comes with the synthetic estrogen and the synthetic progesterone. You should know that this medication may decrease fertility in men, okay? And of course, it'll decrease fertility in women also, because it blocks the receptors of gonadotropin releasing hormone, which, like I said, is the first hormone in the reproductive cycle. So, side effects: Relugolix may cause side effects like hot flashes, skin flushing, sweating, weight gain, decreased sexual desire or ability, muscle, back, joint, or bone pain, fatigue, diarrhea, constipation, difficulty falling asleep or staying asleep, depression, enlargement of breasts. A lot of these sound like the same symptoms of women who've reached menopause. Some side effects can be serious: dizziness, fainting, heart racing or chest pain, swelling of the face, lips, mouth, tongue, trouble breathing, swallowing, all the same things that were mentioned in the Myfembree ad. Chest pain or pressure, pain in arms, back, neck, or jaw, sudden numbness or weakness of face, arm, or leg, sudden confusion, trouble speaking, understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness or loss of balance or coordination. Wikipedia. Relugolix. All right, it's sold under the brand names of Orgovix and Relumina, but it's a gonadotropin releasing hormone antagonist. Same is used in the treatment of prostate cancer in men and uterine fibroids in women. This is what Wikipedia is stating. It's also under development for the use in the treatment of endometriosis. The side effects of Relugolix include menstrual abnormalities, hot flashes, excessive sweating, headache, decreased bone mineral density. Same things. So it suppresses sex hormone levels to the postmenopausal or castrate range in both men and women, with administration once per day. So when you take a pill once per day of Relugolix, it takes you to the phase of the postmenopausal woman, or the castrate level range in men. Less bleeding but same life? No. And if your doctor is suggesting that you take Myfembree, ask your doctor about this statement. Ask your doctor, because I don't think that a doctor is going to disclose that fact and then expect you to still say, okay, I'm going to take it. Okay. In 2019, Japan approved the use of Relugolix treatment of uterine fibroids. So this started in Japan in 2019. And in 2020, it was approved for treatment in the United States for prostate cancer. So Relugolix is a fairly new hormonal therapy. Okay. So that means there are no long-term side effect studies yet. Maybe not. So Relugolix is available in the form of 40 and 120 milligrams oral tablets. So in the Myfembree, it is in 40 milligrams. So that is the lesser amount. The main side effects of Relugolix for uterine fibroids include abnormal uterine bleeding, hot flashes, heavy menstrual bleeding, headache. How is the main side effects for Relugolix heavy menstrual bleeding, but it's an ingredient in a medication that treats heavy menstrual bleeding. Maybe because the estrogen, the combination of the estrogen and progesterone helps with that also. Excessive sweating. And in addition, decreased bone mineral density occurs with relugolix. So 21.7% decrease by week 12. 24.4% decrease by week 24. This is by week 24. That's 6 months. Remember, you can take Myfembree for 2 years. In 6 months, you may experience almost 25% bone mineral density loss. That's 6 months. So that would be 4 times in 2 years. 20. I don't know. I'm a student. I don't know if this is how this works, but in 6 months, you may experience almost 25% bone mineral density loss. So I would just assume in 1 year, you're probably going to experience 50% bone mineral density loss. And then in a year and a half, you're going to experience 75% bone mineral density loss. And then by year 2, you may be experiencing 100% bone mineral density loss. That's just me being extreme. That's just what I would assume as a student. And I'm trying to keep this video as short as possible, so I'm not going to go deeper into that. You can do your own research on that. But I think that that is something you need to know when you are considering Myfembree for your heavy bleeding due to uterine fibroids. A dosage of relugolix of 40 milligrams once per day has been found to suppress estradiol levels to postmenopausal levels within 24 hours in premenopausal women. The estradiol levels have been found to return to normal concentrations within 4 weeks of discontinuation of relugolix in premenopausal women. The medication additionally suppresses levels of progesterone, luteinizing hormone, and follicle stimulating hormone in premenopausal women. So it suppresses all of the hormones that stimulate the eggs to mature, that triggers ovulation, and so forth. So it was stated Myfembree as not being a birth control, and you need to use a non-hormonal form of birth control while taking Myfembree. But relugolix alone in the 40 milligram dosage does suppress those hormones that will lead to conception. Lower doses, the 40 milligrams a day of relugolix, are under investigation for achieving partial sex hormone suppression in the treatment of endometriosis and uterine fibroids. So they're trying to see if it is good to use for endometriosis, or effective for the use of endometriosis situations. So relugolix is only available in the United States and in Japan. All right. So that's just my little research into relugolix. Like I said, synthetic estrogen and synthetic progesterone is also the ingredients in Myfembree. But I thought it would be good to go through this and just talk about all of the side effects that are associated with taking hormonal therapy to control heavy bleeding that are caused by uterine fibroids. Again, this is marketed to a Black woman, and it is telling this Black woman that you'll have less bleeding and the same life. It's like, you know, letting Myfembree take care of all of your reproductive health problems. Just let Myfembree take care of it. And that is not the case. And if you do have uterine fibroids, if you can, my advice to you with my current knowledge is to do everything you can to get rid of your fibroids. There are ways that you can shrink your fibroids naturally. Sometimes the fibroids are too large and you probably should go ahead and get them removed. But electing to take a pharmaceutical that can cause all of these life-altering side effects, I think that women should be well aware of what the side effects are before they choose to take it, so that you can just make totally informed decisions. I think a lot of women, if they heard of these side effects and knew that they were common, that they would choose not to take it. But when they are coerced by their healthcare providers that the side effects are rare and they're very minor, they are not given any options other than, choosing to do it because they may feel desperate because of how debilitating heavy bleeding is. And usually when it's due to uterine fibroids, it's also painful too. So my urge is to please do your research on any medication that you are choosing to take, even if it's aspirin or Tylenol. Do your research and become informed on the risk that you are taking. I really hope that you enjoyed this video. If you did enjoy this video, I want you to please click the like button, subscribe to my channel. Also, if you did like this video, you would love my menstrual cycle awareness charting program. It's my 12-week signature program where I teach you how to observe and chart your unique menstrual cycle patterns so that you can use those charts to either avoid pregnancy naturally without the use of hormonal contraceptives. You can achieve pregnancy naturally without medical intervention, or you can manage and improve your cycles and overall health independently using holistic approaches. If that's something that's of interest to you, please click the link in my description box below and apply for the Restore, Balance, Heal Menstrual Cycle Awareness Charting Program. And if you just feel like you have more questions or curiosities, or you want to talk more in depth about your unique situation, you are welcome to schedule a complimentary discovery call with me. Again, use that link in the description box below for that. Again, thanks so much for watching this video. If you liked it, please don't forget to hit that thumbs up and subscribe. And if you can't wait for my next video, make sure you're following me over on Instagram at starring.tiana. And with that, I'll see you over there and in my next video. Bye-bye.